Okay, welcome back. This will be your video lecture for Chapter 28, Infectious Illness. So let me introduce the chapter to you. Infectious illnesses are caused by living organisms that invade the body, right? And so they include bacteria, viruses, fungi, and parasites. And we're going to talk about all of those. Pathogens, right? Disease producing organisms. So a mild illness can be life-threatening in patients who are immunocompromised. A lot of your immunocompromised patients, like chemotherapy patients, patients who have recent organ transplants, like kidneys, things like that. Many hospital-acquired infections are antibiotic resistant and thus difficult to treat. So yeah, that's been a thing lately. Well, I would say lately, last 10, 15, 20 years now, where we have these bacteria that are smart. They're smarter than the antibiotics that's given to treat them. You have to be able to recognize the signs and symptoms of infection and specific infectious diseases. So let's do a review of AEMT. The skin and mucous membranes, they're a barrier between external and internal environment of the body. So you think about it like this. Bacteria or even viruses, or even the definition pathogen, they're usually very temperature. They need a certain temperature. It's usually a warm temperature, and when they land on your skin, the pH is a very big deal, and our skin is a little bit acidic. So a lot of pathogens that land on our skin never make it inside the body. They're killed on the contact of the skin. So that serves a big infection fighting function. Body fluids, they contain antimicrobial substances. White blood cells, they recognize foreign material and they defend against it. And inflammation and fever is a response that fight infectious disease. That's why I meant, like when I was talking about bacteria being temperature controlled, that's the body's way of defeating bacteria. It knows if it can get it super hot, it can kill a lot of bacteria. So we're going to talk about passive immunity and active immunity. Passive immunity is natural passive. It's acquired passive. It's immunity that, like a baby receives from its mother. And then you have active immunity, which is natural active, and induced active. We're going to talk about those. Pathogens introduced to the body through, injured skin. Right? If your skin, you have a laceration or an abrasion on that skin loses its ability to be acidic in that area, and then you have a pathogen land on it and it finds its way in. Mucous membranes, respiratory, digestive, urinary, and reproductive tracts. That's how they can enter. So bodies exposed to pathogens from, food and water is a big one. Food is contaminated. You can, if you go outside of the United States, some of the water can be contaminated. That's why they say don't drink the water, right? Soil, surfaces, insects, animals, and even other people. Let's look at communicable disease. That's an infection or an illness that's transmitted from one person to another, and that's either directly or indirectly. So directly would be through touch. Indirectly could be something that's airborne. Direct transmission, infected persons in contact with or close proximity to another person. Indirect transmission would be an infected person contaminates a fomite that's another person comes in contact. All right, so when there is a vector contact, like an insect type contact. Infectious illness are classified by routes of entry and exit from the body. Routes of transmission, So direct contact, there's airborne, there's sexually transmitted, bloodborne, and GI. Once pathogens gain access to the body, they must multiply, right, or colonize. A course of infection can take different routes. You could be asymptomatic, like when you first contract HIV, you're asymptomatic until all your killer T cells, which are white blood cells, decide to die off, and then a simple sinus infection can kill you. But the first year or so, you're out there spreading it and you don't even know because you're asymptomatic. It may never become apparent in some cases, and may proceed to a symptomatic illness or illness with symptoms. So let's look at some terms that are related to the infectious process. There's incubation period, latent, window phase, disease period, and types of pathogens: bacterial, viral, fungi, or protozoa. Infection control. So that's the one thing we need to talk about: standard precautions, right? So like standard precautions in our field is gloves. That's the bare minimum standard precaution for a lot of the calls that we run. But if we're going to provide airway management, well, standard precautions would include a mask and eye protection. Hand washing. Right, the number one way to fight infection. I'm sure you'll see it on an exam between now and registry. Hand washing is the number one. Cleaning and disinfecting equipment at work and the environment. Immunizations. Maintaining general good health. If exposed to infectious illness, you follow your employees' policies. Like for a needle stick or something like that, you would follow the policy here to be placed on the right antiviral medication and all of that. And you have an obligation to protect your patient from exposure or to infectious disease. I would go so far to say you have an obligation to protect other employees or other firefighters, other members of personal public safety. An example of that would be you arrive on a 3-year-old difficulty in breathing. You get there, there's a 3-year-old burning up with a temp. You suspect spinal meningitis. Well, it's not necessary to bring, maybe you're on the squad, it's not necessary to bring in the engine crew. Let's don't expose everybody that we don't have to. Scene size up. So certain environments associated with increased risk for infectious disease, right? So you got to think about homeless shelters, things, certain environments that's going to increase your risk. Anytime you get chief complaints like fever, cough, nausea, vomiting, diarrhea, all these are in the slide are signs and symptoms of the flu, right? You want to make sure that you're aware of these signs and symptoms and understand it could be something as simple as a virus or something as bad as spinal meningitis. So the signs and symptoms of infectious illness, I don't think I have to go over this. I mean, it's common sense here. Just about anything can be a general sign and symptom of an infectious illness. We know signs and symptoms of respiratory illnesses. They're a little different, like an earache. How can an earache be a sign and symptom of that? Well, if you have a lot of fluid building up in your sinuses, it can back up into the stationary tubes and cause earaches. Signs and symptoms of hepatitis. Well, upper right quadrant tenderness, right? Because some of your liver's there, right? Jaundice, dark urine, clay-colored stools, anorexia. All of those are signs of hepatitis. Signs and symptoms of meningitis, a stiff neck, the photophobia, possible altered mental status, and those possible, how you pronounce it, purpura, which is like a rash, a prickly type rash. So let's look at the primary assessment. I think we're a little beyond of hearing begin CPR, but if they need it, then we know when to do that. A lot of these you're already doing. Use the appropriate respiratory protection. An N95 would be the best thing to grab. If you're going to have to wear a mask, wear the best one you can wear. You want to observe for fatigue, excuse me, tachypnea, accessory muscle use, wheezing, coughing, all of that. Apply oxygen as needed, ventilate as needed. Tachycardia can be an indication of a fever. So you get there, patient seems very malice, very altered maybe. Check if they're tachycardic, that might be indicating to you, hey, I need to check a temp on this person. And if signs of shock, consider fluid replacement. A lot of times these folks will be hypovolemic, but it's not because of blood loss, it's because of fluid loss or plasma loss. And as an AEMT, we can definitely fix that problem. We can do a bolus, normal saline, 20 milliliters per kilogram. Take the patient's weight in pounds and add a 0. 180-pound patient, add a 0. That's 1,800 milliliters of fluid that you can give. And I would do that, anywhere from 250 to 500 milliliter boluses. And you want to do that until the radial pulse returns. Once the radial returns, you probably have a blood pressure of at least 90. Then you can kind of slow down the fluids. A big deal here is check the blood glucose levels in diabetic and patients with altered mental status. I'll go so far to say, fever really causes a metabolic issue, and it can cause patients to have low blood sugars, especially in children. So always check the blood sugar in a child or an adult really that's running a fever. And we're going to do it anyway if we know they're a diabetic. So adapt assessment and history to patient complaint, presentation, emerging information from assessment and history. Right? So, and then they say test your hypothesis to determine whether the infectious disease will be among different diagnoses. Right? So what they're saying is come up with a field impression that fits what you think it is and then test it. An example, the one that we could test would be, hey, let's give this patient some Narcan, right? If it works, then we'll know that it was a narcotic overdose, right? Recognize if infectious disease is possibility and what body systems could be affected. So, right, so like, say you're dealing with something like a foodborne type of pathogen. Well, you're going to have a lot of vomiting, diarrhea, things like that. And so what body systems there is going to be. It's going to be the stomach, and you're going to have hypovolemia. But flip that coin and think about spinal meningitis. Well, we know spinal meningitis is in the brain. It's the meninges that become infected, and so we know then we're going to have a lot of CNS type symptoms like possible seizures, high temperature, things like that. Your treatment will definitely depend on your patient's complaint, right? We'll probably fluid bolus somebody with a foodborne pathogen, but we're not going to fluid bolus the patient who presents with spinal meningitis. Consider bronchodilators for your patients that have pneumonia. Pneumonias respond very well to bronchodilators, intravenous fluids. High fevers, they say follow your protocols and medication administrations. Here we can give Tylenol to children for high fever, We haven't worked it in yet with Toradol, but Toradol's an NSAID. You should maybe consider that for fever as well. And don't forget, this is super important. Patients with sepsis can be hypothermic, meaning their body, instead of producing a fever, is making them colder. And so that's something to always, and it seems to happen to a lot of elderly patients. The hypothalamus in the brain controls temperature. And a lot of times it starts having some issues as you get older. So instead of producing a fever, you get hypothermic. So reassess, obviously, every 5 minutes for critical, every 15 for non-critical. When we talk about blood-borne infections, they spread through contact between blood and body fluids and non-intact skin or mucous membranes. So you always want to take standard precautions. You want to make sure that you're being really careful with your sharps, and hand washing is essential. I just mentioned HIV earlier, the human immunodeficiency virus, right? It infects T lymphocytes. All right, we call them killer T cells, or a type of white blood cell. The virus uses these cells to replicate itself. If there was ever a virus that was so smart and so lethal, it would be the HIV virus, because it kills the number one cell that we use to fight infection. This results in immune suppression, acquired immunodeficiency syndrome, or AIDS. HIV mutates frequently, so immune systems can't recognize and destroy it. It'll go right by it, because it's kind of like, imagine an airplane getting hijacked. You don't know it's hijacked, and you fly right past it. Nobody knows, right? So that's the same thing here. This is called Kaposi sarcoma. And that was in case you're listening to the lecture and not looking at it, it's just it's a rash that has this like red petechiae type rash. HIV AIDS, they're prone to numerous infections and cancers, and CNS eventually affected. So some of the signs and symptoms, once they do develop signs and symptoms, right? It may take a year before they develop their first fever, night sweats, lymphadenopathy, which is swollen lymph nodes, unexplained weight loss. Any infection in a patient with HIV and AIDS is definitely more serious because of them being immune compromised. Doesn't matter. It could be a sinus infection and it'll kill them almost. It may even kill them because they can't fight it off. Pneumonias, tuberculosis, and the picture I just showed of the Kaposi sarcoma, they're seen in patients with HIV and AIDS. Hepatitis, they talk about A and E here. They spread through fecal oil routes, including contaminated food. This is somebody who's in the kitchen who doesn't wash their hands after they go to the bathroom, and they infect your food. Types B, C, D, and G, they spread through blood and body fluids and shared drugs, acupuncture, tattoo needles. People who share needles, drug abusers who share needles. The signs and symptoms of hepatitis: flu-like symptoms, headache, fever, joint pain, a general feeling of just weakness or malice, nausea, vomiting, and loss of appetite. Respiratory infections, mild to lethal depending on infectious agent. Types of infections: pneumonia, influenza, RSV, and bronchitis. We can add in there other respiratory infections include the croup, tuberculosis, SARS, and upper respiratory infections. So TB. TB spreads through respiratory droplets It manifests as respiratory disease and can affect many different body parts. Higher rates among patients with HIV and AIDS because they're immunocompromised. And some of the signs and symptoms of TB: fever, chills, night sweats, fatigue, chronic cough, and hemoptysis, which is coughing up blood. And TB's kind of back on the comeback here. We've seen it a lot here lately. Pneumonia, it's many different infectious agents cause pneumonia. It could be virus, could be a fungi, or even a bacteria. The risk is increased in smokers, the elderly, chronic illness, immunocompromised patients. Smokers is obvious why that is, but elderly, right? Well, not only because they have their immune system is compromised because of their age, but also they lose that ability to cough. Like, I've been coughing like the entire time of this lecture. I wasn't coughing before, but now I am. But elderly patients lose that feeling to cough when they need to cough. And so that increases their risk for pneumonias. Sudden onset of high fever with chills, difficulty breathing, pleuritic type chest pain, meaning it's reproducible, right? Cardiac chest pain is not reproducible, but a respiratory type chest pain is reproducible. When they raise their arms, it hurts more. When they move, it hurts more. When you palpate their chest, it hurts more. All of that's reproducible. Excuse me, often localized to one lobe of the lung, right or left. This is a picture of a pneumonia in the right lung. And you can kind of see it like right up in here. Compare it to over here where it's clear. Over here is kind of, you see the shadows. Influenza, colds, pharyngitis, bronchitis, right? There also can cause these respiratory infections. The common colds caused by a rhinovirus or even the coronavirus. Pharyngitis is just what it is. It's, pharynx is a fancy word for the throat. Itis is infection or inflammation, sore throat, right? Acute bronchitis, inflammation of the bronchiole. The flu, right? We know it can cause respiratory problems. It may not. The flu, it may cause GI problems. But for the most part, there is like usually a type of dry cough that goes along with the flu. Highly contagious. It's significant mortality rate. I mean, the flu kills people, especially elderly and young. The flu is usually a sudden onset, right? I swear, 1 second you're feeling great, the next minute, oh my God, I feel like a train hit me. Fever, chills, sore throat, the body aches, right? Complications from the flu: dehydration, pneumonias, encephalitis. We all know about the coronavirus. I think we're all pretty familiar with that one. SARS is a coronavirus infection that causes acute pneumonia-like illness. And good old pertussis, or whooping cough. Serious, sometimes fatal disease that causes coughing fits that are characteristic of a whooping sound. There's a vaccine for that now in children, so we don't see it as much. Believe it or not, we actually see it in adults. That's more prominent now than we've seen in children since the vaccine. The bubonic plague and hantavirus is caused by rodents. Okay, it occasionally occurs in the U.S. and the Southwest. These rodents are infected by fleas, and these fleas jump off one person, off that animal, can jump onto a human and cause illness. Domestic arboviruses transmitted to humans by insects. That's kind of what I just talked about. And can cause infections and encephalitis. Childhood illnesses. Croup is a childhood illness characterized by that seal bark, respiratory distress and airway obstruction in severe cases. But humidified oxygen prevents drying, irritation, and further swelling of the airway. Epiglottitis, another childhood illness that we don't see that much anymore, thank God, because it was really bad. We have a vaccine for that. It's a rare bacterial infection. Because we have the vaccine, we can call it rare now. It's swelling of the epiglottis. You need ALS support for these calls, but really there's not a paramedic in the world that wants to come to that call, because unless we just have to, we're not gonna touch that airway. These patients are usually a one-time shot at being intubated, and I definitely don't want the one time to be in the back of a dim lit ambulance as I'm going down the road. Mumps, measles, rubella, and chickenpox, and there's a vaccine for that. The mumps is a viral infection that affects the glandular tissues, but the measles, as we all know, is on a comeback because of lack of people not getting the measles vaccines like they should, the MMR. And chickenpox, we even have a vaccine for that nowadays. Chickenpox is a viral disease. It's located in the herpes family. It just generally malice and itchy, fluid-filled blisters on the skin that later crust and scab. And showing now a picture of the chickenpox lesions all over this guy. He looks like he doesn't feel good either. Meningitis is another inflammation and swelling of the meningenes that surround the central nervous system. It can be viral or bacterial. Bacterial is usually transmitted through contact with nasal and oral secretions. Bacterial seems to be more serious than viral. And the signs and symptoms here are fever, headache, photophobia, and a stiff neck. Encephalitis. Encephalitis is an inflammation of the brain tissues. All right, and so signs and symptoms are similar to those of meningitis. And common causes of encephalitis is West Nile, Eastern equestrian, I guess is what, I don't know, encephalitis, herpes virus, and toxoplasmosis. Tick-borne illnesses such as Lyme disease or tularemia. Tularemia, also identified as a potential weapon of bioterrorism. So an infection is fatal if not treated. We have Rocky Mountain spotted fever, and we get that from tick bites. How about a good old case of rabies for you? Right? Very rare, but fatal in humans. That's why if you get bit by a dog and we can't confirm that it's had its shots, you have to get the rabies shots. Our gastrointestinal infections and botulism. So caused by foodborne or waterborne pathogens or through oral fecal route of transmission. Causes is Salmonella, E. coli, the norovirus, which, God, that stuff's so bad. You're just sick for a couple of days and it's a bad sick. Signs and symptoms: cramping, nausea, vomiting, diarrhea, and sometimes a low-grade fever. Botulism is a bacterium that produces neurotoxins. It's found in low acidity canned foods that are improperly processed, and it can cause paralysis by blocking the release of acetylcholine and motor neurons. It's not very common. Mononucleosis is a viral infection. It causes fever and fatigue. It affects the upper respiratory system, sore throat, swollen tonsils, and large painful lymph nodes. Herpes simplex virus affects the mucous membranes and skin. Infection results in blisters that ulcerate, and the virus remains dormant between outbreaks, so it does not go away, no matter what they told you. It won't go away. Here's a little herpes simplex 1. It's a picture of that. How about scabies, lice, ringworm? present with intense itching and skin lesions. Both scabies and lice are external parasites. Scabies can caused by mites that burrow under the skin, and they lay eggs. It causes rash with intense itching, and they're transmitted through direct skin-to-skin contact with an infected person. And I'm showing a picture now of what scabies look like on the abdomen. How about lice? Tiny little insects that infest the body, and they use hair shafts to deposit eggs. Those eggs are called nits. Infestation with lice, head, pubic, body lice, they spread by close contact with an infected person. I'm showing a picture now of the head and lice. Are hard to see, but the itching they cause, it can lead to irritation. And that's what it's showing there. It's gross. So gross. How about some ringworm? The Tinea corporis. It's not a worm at all, but a fungus that results in itching, circular lesions on the skin. It's spread through direct contact with another infected person or contaminated soil, so wear your shoes, and infected pet. That's very interesting. Impetigo, caused by streptococcal or staphylococcal bacteria. Here's a picture I'm showing of the ringworm. And here's a picture of impetigo. How about some boils? Painful abscesses that result from infection of hair follicles or oil glands. And the cause here is staphylococcus. About some MRSA, that's methicillin-resistant Staphylococcus aureus, resistant to antibiotic use to treat staphylococcal infections, affects the skin. So how that works is you are sick and you go to the doctor, you're diagnosed with a bacterial infection, and you receive an antibiotic. And you take about 4 doses of it. You should take 10 days. But after the 4th day, you feel great. And you forget to take it. And the next day, you forget to take it. Before long, you just don't take it. Well, the bacteria is pretty smart. And it can lie dormant for a long time. And when it presents its head again, it starts making you sick. It's also smart enough to know that it was penicillin last time that killed it. And now it's resistant to it. So now I have to find another antibiotic that will work. I'm showing a picture of a boil right now. This is a carbuncle. I'm showing a picture of that. So sexually transmitted infections can affect the genitalias, can affect other structures, and have systemic effects. Avoid contact with skin lesions and discharge, and wash hands after contact, most definitely. Gonorrhea is a bacterial infection. It's painful when you urinate and purulent urethral discharge in men, asymptomatic in women. Syphilis, bacterial infections transmitted sexually. It can be transmitted through contact with lesions. Untreated infected women can pass the infection to the fetus. Can have congenital syphilis. All right, this is a diagram 28-1 of the stages of syphilis. Genital warts, fleshy growth caused by HPV, certain types associated with cervical cancer in women. Chlamydia. Chlamydia is caused by an organism that has characteristics of bacteria but lives within cells. They can affect the eyes and the respiratory system and spread through secretions and sexual contact. Well, I hate to end on chlamydia, but that's exactly where this lecture will end. I hope everybody's doing well and look forward to seeing you soon.